And the next one, right after that wonderful hormone lecture, he will now be speaking to us about a different thing, but his experience actually for more than 2 decades is his career on hormone testing. Okay? He has a doctorate degree in biochemistry and master's in business administration. Is an entrepreneurial executive, scientist, speaker, anti-aging expert, and educator for more than 25 years in research laboratories and clinical laboratories related to diagnostics and biomedical device industries. He is the founder and CEO of Iometrics, a research, consulting, and diagnostic organization that offers specialized high-complexity functional laboratory testing for future and consulting services for platform technology firms and diagnostic companies. He is also involved as a scientific and marketing advisor and consultant for various medical device and diagnostic groups, helping with strategic planning, resource allocations, new business development, and achieving timeline milestone by partnering with ongoing relationships within targeted accounts. Let us welcome Dr. Sanjay Kapur.
Thank you for the wonderful introduction. Good morning to all of you. Well, still, I guess there's 1 more minute till we get into good afternoon. Good morning.
Morning.
Thank you. I was just trying to check your cortisol levels. See, that was a wonderful lecture on hormones, and I'm so passionate about hormones. I love hormones. And I would have loved to do my testing lecture right after this. That would have made perfect sense, because that's what is my passion. And as far as the present lecture that I was asked to do, I'm still trying to figure it out. So please bear with me. I'm learning just along with you. Just adding a little comment to the hormone lecture that you just heard. As Dr. Mokhtar pointed out, transdermal is the way to go when you're doing bioidentical replacement therapy. It's very important to know how to test hormones as well when you're doing the replacement therapy, and whether to use blood, whether to use saliva, whether to use urine. So there are different scenarios when to choose the right body fluid to test these hormones appropriately so that you can do the replacement very well. Anyways, I really don't want to start my testing lecture now and stay on the one that I'm asked to do. But before I start the lecture, Dr. Homer said, Sanjay, you have 3 hours now to talk because nobody sponsored the lunch today. So keep everybody busy there. So please bear with me. No, don't worry, I'm just kidding. They are setting up the lunch, and I'm the only one in between you and the lunch. And I know how much you would love me for that. Anyways, thank you so much for being here. And I've really enjoyed these last 2-3 days of the conference, and thank you to the organizers for inviting me, even after they heard me speak before. So I'm glad. Anyways, can I have my slide here instead of my bald head? Perfect. So usually I start my lectures by playing a little game, because some of you I know from previous conferences. I've met with you, but not all of you. And until we become friends, you're not going to listen to me. So the only way to become friends within 2 minutes is by playing a game, right? Kids start playing together and they become friends. So that's how I become friends with people that I meet with at these conferences. So are you ready to play with me? Thank you very much. I know some of you have played this game, I mean similar game with me previously, and you didn't win. Sorry. And let's see if you can win today. And so to play this game, what I'm going to do is I'm going to show you some questions here. And if the answer to your question is a no, then you can sit down. Well, you'll ask me, you're already sitting down. So may I please ask you to please stand up wherever you are. Don't worry, you still have some cortisol levels. And I'm not going to ask you to do anything crazy. Trust me. Take my word for it. I will not ask you to do anything crazy. I've done that in the past, though. I've asked people to dance, but not today. So if your answer to this question is a no, please sit down. You are not a smoker. So if you smoke, please sit down. Your BMI is less than 25. And if your answer is a no, please sit down. And don't look at anybody else. All right? You eat 5 servings of fresh fruits and vegetables every day. And if your answer is a no, please sit down. All right, well, we still have some people standing in the room. You exercise at least 30 minutes per day, 5 days a week. Come on, people, you're doctors. You're all doctors. Anyways, you don't consume any alcohol or only once or twice every week. Wow, we still have some people, it's still standing. 1, 2, 3, 4, 5, 6, 8. Okay. Let's see who wins after this last question. You have never been exposed to any chemical or environmental toxin. Did I make my point? This is kind of sad. I've never found a winner. So this is who we are today. This is the environment that we live in today. So you know where I'm going with this game, right? So just to give you a little bit introduction about myself, where I'm coming from, I live in Portland, Oregon, which is really, really beautiful, most beautiful city on this planet, which I feel. We get the most beautiful fall season in Portland, Oregon. All of the Oregon, we see all these beautiful colors changing in the fall. Well, this is a glimpse of my lab. They mentioned in the introduction that I run a functional testing lab in Oregon. So this is where you can find me every day if I'm not traveling. And this is where I was last week. Well, don't focus on my sexy legs. I was in Hawaii, so I'm extending my vacation this week, and I'm here. So I want you to just focus on this black sand. It was a black sand, literally black sand beach where I was, and this black sand was formed by lava rocks. And then on the same island, I was on the Maui Island. And on the same island, there were black sand, there was red sand beach, and then there was this white sand beach. Again, don't just focus on this handsome guy there, but just this beautiful white sandy beaches and blue ocean. And the sunsets were awesome, just beautiful, right? And this is, I'm sure Dr. Homer knows, this is my dream vacation spot where I want to go, which he canceled last time when he invited to Manila. This is Boracay Island. So Dr. Homer asked them to close the island because I was planning to go there. Anyways, nature is beautiful, right? I mean, I could show you these beautiful pictures all day long. Our planet has beautiful nature to offer to us. But what have we done to this planet? What are we creating? What are we giving to our kids? Yes, it looks funny, but it's kind of sad. The environment that we have created, we've totally messed up our environment, and the gift, so-called gift of toxicity that we are planning to give to our children, our grandchildren, if we didn't really stop here right now and paid much attention to what exactly are we giving to our next generations. So I'm going to be focusing my next 3 hours on heavy metals. Some toxic metals. Well, heavy metals can be toxic and non-toxic. So not all heavy metals are scary. Some of them are toxic. So we will focus on toxic metals today. So there's a difference between toxic metals versus heavy metals. These are toxic in nature, obviously, naturally occurring in soil, water. These are non-degradable. These cannot be destroyed. So it's very dangerous, very prevalent in our environment, and they occur near the bottom of the periodic table, as you can see here. So some are toxic, some others are non-toxic. Mercury, for example, it's very, very toxic. Selenium, not much, but yes, it is. Most metals have functional roles in the body, like selenium. And some of them, they have absolutely no physiological function in the body, right? Like arsenic doesn't have any lead, or some metals have no physiological functions. Mercury, the most toxic that we know as of today, and where it comes from, I know I don't want to scare you, people who have dental amalgams in your mouth, in your teeth. That is the number one source of methyl mercury toxicity in our bodies. And of course, in addition to methyl mercury, fish now is being considered as the second major source of mercury. People who eat a lot of fish, and especially fish like shark or swordfish have much, much higher content of mercury rather than many other kinds of fish. There are some safer fish to eat, like wild Alaskan salmon, halibut, trout, shrimp. There's still mercury in those kinds of fish, but the content is low. Some metals have a very narrow physiological range. What does that mean? It means these metals have a very small physiological functional range, and out of that, it could be toxic. Well, they are helpful in a particular range, but if it goes out of that range, they are toxic. For example, selenium. Now, it depends on the biochemical individuality. Everybody is different. See, in medicine, I always say that one size fits all doesn't work in medicine, and I'm sure all of you would agree on that, right? We just have to customize the treatment for each individual patient that you see. So, and that's what I mean by biochemical individuality, and it's all based on individual lifestyle, genetics. We all have different genes. We all have different lifestyles. So why we have to have one treatment plan or one treatment protocol for every individual. And so we get exposed to these metals through different routes. Subcutaneous injections or oral exposure, inhalation. Inhalation is the major source of exposure that we get exposed to all these metals. And basically what do these metals do is they result in production of reactive oxygen species, right? So there's a lot of oxidative damage that begins inside the cells and resulting in complete oxidative stress. Can you hear me at the back? Can you all hear me? The last man standing there? Okay, perfect. Because I don't want you to fall asleep on me. And I'm going to ask you questions in between, instead of you asking me questions. Anyways, so, and there's a defense mechanism in our bodies that takes care of most of the oxidative damage that we go through. And as long as we can support this natural defense mechanism in our body, we can be in good shape and fight against any kind of toxicity process. So there is a process of detoxification and elimination, which we are going to be looking at in the next 3 hours, right? Don't worry. I keep scaring you, but don't worry. They still have the lunch. Anyways, so toxins, as I said, enter through lungs, skin, and gut mainly, because these are the areas that we are exposed through to our surrounding environment. And then the liver is the one that basically takes all that hit to take care of all of this trash that goes inside the body. And after the liver has done its job, all these toxins basically find their exit route through skin, kidneys, colon, and lungs, right? And during all of this process, there are some side effects which cause all these different conditions that you can see here, and I'm positive that you cannot read any of these from this slide. But please feel free to access these PowerPoints from the organizers so that you can go through these slides later on. Because I'm sure there are few slides which I was so passionate to include a lot of material, but I'm positive that the person sitting at the end cannot see that. So please take a copy of this PowerPoint from them. So we will focus today mainly on arsenic, cadmium, and lead. Well, you might say, why not mercury too? It's the most important thing. But mercury deserves a complete individual lecture on its own. And I won't be able to do justice to mercury toxicity if I include it in this lecture. So anyways, CDC's priority list of hazardous substances have been: number 1 is arsenic, number 2 is lead, mercury is number 4 for some reason, I don't know what is that, cadmium is number 7. So these are the main toxic metals that get a lot of attention there have been reasons, because of the events that have occurred in the recent past. Flint water crisis in Michigan, I don't know how many of you have heard about it. There was almost about 100,000 people were affected by lead just because the state government decided to change the source of water from a lake to a different source. And there was some lead contamination because of the way the water was directed to these people. And about 100,000 people were affected very, very badly with lead contamination, and all the lawsuits are still going on as we speak today. There is arsenic in all kinds of processed food that we eat today. So this is what I have the biggest problem with. Beautiful packaging and colorful foods. And that's something that we were talking about last night at dinner. The processed food is the main source of metal toxicity now, and especially the arsenic and cadmium. A lot of these processed foods have high content of cadmium. Turmeric and many other spices were recalled about 3-4 years ago in the U.S. Because there was a very, very high content of lead found in these spices. And McDonald's had to recall this little glasses, the Shrek glasses, back in, I believe that was in 2014 or so, because it was found that there was a very, very high lead and cadmium content in these paint that was used for these glasses. And these glasses were included in the Happy Meal for little kids. And so, I just picked up some of these examples to share with you why we should be worried. And a lot of candies are sold on Valentine's Day. You have to be really, really careful what kind of chocolate or what kind of candies are you buying, because these have the highest lead contamination. Most of these candies that are sold on Valentine's Day. So you might want to reconsider giving candies to your sweetheart. Change it to flowers. And tell them that why I'm not giving you chocolates this time. All kinds of baby foods. Your patients, tell them they have to be really, really careful about choosing the baby foods that they're using for their babies, because lots of baby foods have been or are continuously being recalled for lead and cadmium, and some of them arsenic as well, contamination. Some of the popular protein supplements, can you imagine? Protein supplements that we think that, okay, this is going to make give me wonderful protein levels. And so those have been found with lead and arsenic as well. Anyways, so you just get an idea that everything around us in this environment, the food we eat, the life we live, we are continuously being exposed to all of these toxic metals, right? Are you still with me? See, if you're not, then I'm going to start my lecture from all over again. I'm really going to torture you if you're not with me. So please pay attention. Anyways, so let's talk about these individual metals one by one. Just a brief glimpse that I can give you today. I cannot do justice to give you everything that is known about these metals. So arsenic is both organic and inorganic kind. So where do we get the organic arsenic from? Shellfish, all the crabs, clams, oysters, lobsters, mussels are very, very rich in organic arsenic, and button mushrooms. It's mainly non-toxic. Comes in and goes out of the body unchanged. Nothing happens to it. You just take it in, it goes out. So I didn't mean to scare you to stop eating crabs or clams or oysters. But whenever you're testing for these metals, whether you're using urine or whether you're using hair or any other body fluid to test for heavy metals, make sure to instruct your patients very, very strictly, especially if you're looking for arsenic. If you're testing for organic arsenic, tell them to avoid eating any of these sources of high organic arsenic at least 4 days before testing. And, any lab that you're using, see if their instructions clearly mention that you have to stop eating these foods at least 4 days before you test. Otherwise, you will see a very high level of arsenic in that, and you might start a very different treatment plan based on that. So you might get scared, your patients might get scared. It's just a matter of following the right instructions for testing. Then there's this inorganic arsenic, which is found in soil, comes from all the fertilizers. So basically, we are dumping in arsenic in the form of different fertilizers that we use, pesticides. I mean, see what we are creating to our Mother Nature, and then we complain that we have a contaminated soil. Water, we get all kinds of contamination of arsenic from drinking water. Rice is the main source of arsenic. Don't worry, they just prepared wonderful rice today, free of arsenic. Well, they asked me for that what kind of rice, and I told them, go get the rice from India. No, I'm just kidding. Well, don't be afraid. Not all the varieties of rice are contaminated. There are very few areas on this planet where the water is contaminated with arsenic. And well, I had a map of the U.S., which actually didn't make sense to show here. I was looking for a arsenic-contaminated area in Malaysia, and I couldn't find it, which is actually a good thing, right? So you should all be happy that I couldn't find a source of contamination of arsenic here in Malaysia. I'm sorry? Oh, okay. So there are some areas where the water is contaminated. So any rice variety grown in those areas, I'm sure you should avoid that, right? Apples. Lots of apples are contaminated with arsenic, and that's because of the pesticides used on apples. Chicken, again, not all the chicken, especially not the organic chicken. So don't be afraid to eat anything today that you see on your lunch table. Everything is arsenic-free. Treated lumber, the high-pressure treated lumber that used to be used in residential areas for construction of homes. I don't know about Malaysia, but in the U.S., that was what was used earlier, prior to 2003. It was all contaminated with arsenic, and because it was treated with all kinds of different chemicals containing arsenic. It comes from industries, batteries, glass manufacturer industries, and so on and so forth. How does it get in? How does it get into your body? Well, we ingest it. We eat contaminated food, as I was talking about chicken and apple and rice, apple juice. Most of the varieties are contaminated. I'm so sorry to keep scaring you. Drinking water, that's how it goes into our body. We inhale. Well, we cannot stop breathing, so I can't recommend that to you, and you can't recommend that to your patients to stop breathing. Can you? Transdermal pressure-treated wood that I just shared with you. So how does it get out? We talked about how does it get in, but how does it get out? Well, we need to know that. Well, most of us, we know what is methylation and what is glutathione, how important is glutathione when it comes to detoxification and when it comes to antioxidant defense mechanism. You all know that, so I don't need to spend time there. Excretion through kidneys, and where does it store? All these inorganic arsenic is mainly stored in hair, nails, and skin, bone and teeth as well. So that's something important that you need to keep in mind. I don't think I would like to spend time on glutathione. You all know. Well, this is a beautiful slide. I wanted to take your test on this, but we'll pass. You can take a sigh of relief. So no test today. What does it do? What does this inorganic arsenic do to our body? So all kinds of skin rashes, digestive complaints, GI tract, the gut issues, leaky gut syndrome, cardiovascular issues, lung conditions, diabetes, neurological conditions, Well, it's a neurotoxic, right? And different kinds of cancer. There's been a lot of studies that have shown there's so much of research out there that has now given us all these different studies that have clearly established the role of arsenic in different conditions. There is a direct correlation of people living in those highly contaminated areas with different types of cancers and cardiovascular issues. How do you test? We talked about how does it get in, how does it get out, but as clinicians, you need to know how to test these heavy metals. Well, urine is a good source of measurement of these heavy metals, and we will talk a little bit more on why urine, because at the dinner day before yesterday, Dr. Edward, you asked me that you were using hair for metal analysis. Well, hair is also a good source, but you have to make sure to test the root of the hair, because most of the metal is concentrated in the hair root. And also, hair only provides you a measurement of acute toxicity, because what happens is that the metals circulating in blood, they take the metal and concentrate it in the hair root, so you can measure the metal concentration which was available only during the last 6 weeks in blood, right? So it gives you only a measurement of acute toxicity, not the chronic toxicity. You cannot measure a total body burden by hair analysis. You can, and I will tell you a trick how you can. Well, let me tell you right now. Why wait till later? So with hair, you should be using frequent testing after about, let's say, 6 to 8 weeks. Once you start a detox program. And why? Because what happens is when you're using a detox program, you dislodge metals, and those metals somehow again come and concentrate at the base of these, like the roots of the hair. So you do the first round of testing, then you start the detox program, then you test the hair roots again after about 6 to 8 weeks. And you will see that there is a change in the level of different metals there. Let's say if you're looking for mercury and let's say you're looking for aluminum or selenium or whatever, manganese, you might see a change in mercury levels. You might not see a change in manganese or any other metal. So you know that mercury has been dislodged because of your detox program. So that is also a good way to measure whether your detox method is working right for a particular metal. And another thing to keep in mind is that you cannot focus on one particular metal and target your detox program based on only one metal. You have to look at it as a whole picture. You have to think that when you're using a detox program, all of these different metals will be dislodged from wherever they are kind of hiding in deep connective tissue or wherever. And the trick of your detox plan or the protocol is to make sure that these metals are not immediately taken up back into the body. Well, you can dislodge them, but you have to make sure that you throw them out of the body as well, immediately, before they are picked up by the body again because of their fat-soluble nature. Especially fat-soluble metals, they will be taken up by the gut immediately. So make sure you use a right protocol. Anyways, I get passionate when I start talking about testing. And for obvious reasons, I run a lab. Hair, we talked about hair. Well, urine is the number one source. So CDC says that total arsenic is less than 50 micrograms per liter is safe in adults. But research has shown something else, and it has shown that total inorganic arsenic less than 16 microgram per liter is considered safe, not really 50 micrograms. So anyways, blood is used only to test for acute, not the chronic toxicity. Drinking water, EPA says less than 10 ppm is safe. And research is that no safe level of arsenic. So you can make a decision based on that. How do you protect yourself when it comes to arsenic? Avoid high arsenic foods? Duh, yeah, it's common sense, right? Sanjay, come on. We know that. Check your water for arsenic levels if you can, if you have access to those types of resources. Make sure you take good antioxidants, green tea, curcumin, etc. You support your diet with some good antioxidants because the idea is to support your defense mechanism. So good selenium levels, again, maintain a proper physiological range. They're good methylfolic acid and metal donors like selenium, methyl B12, folate, cysteine, etc. And good glutathione levels. And I'm sure you all agree with me on that. That's why you're nodding your heads. Are you still with me? You know what's going to happen. So that was all about arsenic. Well, not all about arsenic, but a little information about arsenic. So let's focus on cadmium for next few minutes. So what are the sources of cadmium? Where are we getting this cadmium from? Tobacco is the main source. All kinds of smoke that we are exposed to, we inhale cadmium. And it doesn't matter whether it's an e-cigarette, e-pipe, or whatever. Any kind of tobacco smoke or any kind of e-cigarettes, we are getting exposed to cadmium. Again, soil, and we get it from fertilizers, rice and grains, shellfish, batteries, paint, ceramics, all kinds of beautiful ceramics that we use to entertain our guests. We are actually giving them cadmium instead of green tea. So we have to be careful what we are using. The painted ceramics, especially the glossy ceramics. Jewelry, metal plating, burning coal, all of these are the sources of cadmium. How does it get in? Ingestion, again, is the main source. Drinking and eating, all these contaminated foods. We talked about rice and apple juice. About 5 to 10% and up to 30%, depending on mineral status, comes from food. All different kinds of contaminated food that we eat. Inhalation, we get 50% of the cadmium through inhalation. And transdermal, like touching different contaminated surfaces, is also another source of cadmium. How does it get out? Well, glutathione again comes here into the picture. Good glutathione levels are required when we are thinking about cadmium detox. Metallothionein zinc is a wonderful source which can support our system to take care of the cadmium contamination. So where does it go? It can last up to 30 or plus 30 years in our bodies. So once you get contaminated, once you get exposed to cadmium, it can stay in your kidneys, bones, and liver for more than 30 years if you didn't really take care of it before that. And what can it do? It can cause cardiovascular disease. It can cause kidney diseases, liver lesions, and cancers again. All different kinds of issues can be caused by arsenic, cadmium contamination. How do you test for cadmium? Well, urine again is a good body fluid to use when you're looking for cadmium. Remember that most of these metals can be tested very well in urine, but it's only the lead which is not reliable measurement in urine. So for lead, you should be using blood because it stays most of the time in blood. So for lead, remember that. Lead to be tested in blood. All other metals can be tested in urine or hair. So in adults, according to CDC, less than 3 micrograms per gram creatinine is safe. But research, again, has shown something different because I think CDC still hasn't updated their guidelines based on the recent research, because now we follow very recent updates. So research says that 0.5 micrograms per gram or anything less than that is safe. And for children, CDC says that there is less than 1 microgram per gram is safe in children, but research again is contradictory. Research says that no level of cadmium is safe for kids. And as I said, blood can only give you acute exposure. Like blood can give you the measurement of only a recent exposure to cadmium. It's only lead that you can measure in blood. How do you protect yourself? Take extra zinc, extra calcium. Make sure your iron status is good. Avoid high cadmium foods. Absolutely. Stop smoking. Well, I saw there was only one smoker in the room, so it's great news. And that one smoker, please stop smoking. Lead. What are the sources of lead? Well, mainly it's the paint that was being used earlier. Most of us have stopped using paints that were used before 1978 that had very high lead content. And the gas, the petroleum that was being used earlier for our cars, that was banned in the USA in 1996. I don't know about Malaysia. What is the status here? We are not using the same gas, right? Contaminated with lead. What is the lead concentration here? Anybody knows? Oh, unleaded. It's completely unleaded. Wonderful. See, when I ask questions, you have to talk to me. I'm here to learn more from you instead of I educating you more. I just made a few slides and came here.
What does the CDC stand for? The CDC is the previous slide.
Center of Disease Control. So race cars were using that kind of gasoline in the U.S., and that was banned in 2008. Small planes, some of the small planes are still using. So these are some sources. Water, there are some pipes that are still being used as solder, garden hose connectors are still very high source of lead. Pesticides, most of them, all pesticides are a good source of lead. Well, I shouldn't be saying good source, but right, they're bad sources. Soil, different kinds of plants, again, poor plants, they're not producing lead. They're just being exposed to fertilizers and pesticides, and that's how we get contaminated by eating some of those plants and greens. Chocolates, we did talk about that earlier in terms of arsenic, but there is high lead contamination as well in many varieties of chocolates. Apples, green tea. We talk about beneficial effects of green tea, but please make sure that you're using a right variety of whatever food, not just green tea, but whatever food. Look at the labels, and so this is another thing that we have to work together to fight with the regulators, to have them force these food companies to provide accurate information about these metals on their food labels, the packaging, which is not being done. I mean, you're on your own basically. You don't see how much lead is there in that food, or how much arsenic or how much cadmium is there. So we have to fight with these regulators to force food companies to include that information. Pigments, all kinds of these ceramics, glazed ceramics especially, you get lead contamination. Jewelry, beautiful jewelry, beautiful beads, all glazed. They're all contaminated with lead. Christmas lights, mini blinds, there are all kinds of sources. Bullets, well, you don't have to worry about contamination from lead with bullets. Once you get shot, you can't change anything about bullet. Supplements, all kinds of supplement, well, I shouldn't say all kinds, but there are many different varieties of supplements that you have to make sure that those were not recalled, or there's not known contamination of lead or any other metals. Lipsticks, ladies, I'm sorry, please make sure that you're using the right brand of lipsticks. It doesn't mean that you use expensive brands. Many expensive brands have been shown to be contaminated with lead. So you might find some very, very cheap lipsticks, because this is something I really want to share with you. Nothing to do with the lecture. A thought just popped up in my mind when it comes to lipstick. I can never tell just looking at anybody that you're using a cheaper lipstick or an expensive lipstick. I just like the color. For me, if the color is good, perfect, right? So do not decide which lipstick to use based on its price. It might be contaminated with lead. Anyways, so how does it get in? Main source is the ingestion. We are ingesting all of these metals, drinking and eating. Children get exposed to lead. Almost 50 to 50% of their exposure is ingestion. And in case of adults, is my microphone working? Is it working fine? Oh, okay, great. Inhalation, almost 95% of the contamination of lead that we are getting as adults is from breathing. And some is coming from touching contaminated areas, right? Where does it go? In children, all of the lead, or most of the lead, is going into soft tissues and bones. So 50% of it is being concentrated in bones. So whenever you're looking for lead contamination in children, please focus on bones and soft tissues. In adults, most of it is going and depositing into the bones. So you know where to look for it. If you know that somebody has had lead exposure and known exposure, then you know where to look for it, right? So that you can decide your detox plan according to the information you have. What does it do in children? All kinds of neurological impairments, learning disabilities, lowered IQ. There have been a lot of research, a lot of studies that have shown a direct correlation of children living in those contaminated areas to their learning disabilities. And behavioral issues, colic problems, and poor vitamin D metabolism. Well, poor vitamin D metabolism is basically everybody has vitamin D deficiency, especially people, well, not, I would say the lifestyles that we have now today. We don't really go out much and expose ourselves to sun. And most of us don't really pay much attention or focus on taking additional vitamin D. And Dr. Narjit, the other day, he asked me, Sanjay, how much vitamin D are you taking? And I said, well, I do 2,000 IUs per day. And he says, 2,000 IU, it will not even affect your tip of this finger, right? And well, he gave me 50,000. And within 2 days, I feel wonderful. I'm up and running. I was probably jet lagged the other day I saw you. But what I'm trying to say is get a good support from vitamin D supplementation and take good amounts of vitamin D. And I think 5 to 10,000 per day should be good enough. What do you guys think? 10,000? Okay, let's decide on 10,000 today onwards. Yeah? All right. So you're listening. I just like to confirm in the middle that if everybody is still with me. Lunch is still not ready yet. Is it going to be there? Dr. Homer? No lunch, right? Tomorrow? Okay. So you want me to keep talking? Okay. Oh, there you go, see? She says 10 minutes, and I just started my lecture. That's not fair. Anyways, I will try to go much faster now. See, it's not my fault. They had really told me, take as much as time you want, because lunch is tomorrow. Now they changed their mind. That's why I was going slow. Anyways, so what does it do in adults? Cardiovascular issues, hypertension, coronary heart disease, stroke, etc., etc. In men, that's the main issue, that's the main problem, erectile dysfunction. Well, it's not just the testosterone that you heard earlier. It could be lead contamination. So, see, this is where you have to be really smart. When somebody comes with a complaint of erectile dysfunction, you can't just go directly on testosterone. You have to know the whole picture, the whole story, and find out, oh, well, maybe it could be lead, right? You tested hormone, okay, fine. You decided to go testosterone way. You tested their hormones. You found out that testosterone is normal. That's confusing. So what do I do now? Well, that's the time when you can start thinking about other things, other possibilities. Bone issues, cataract, kidney disease. And how do you test? Well, lead, you have to use blood, not urine for lead. So any kind of acute and release from the bone can be measured in blood. And CDC says action if greater than 5 micrograms per DL in children. And in case of adults, if it is more than 10 micrograms per DL, that's when you should be worried about. But at the same time, CDC says that there is no safe level of lead in, of course, adults and children. But there are several studies now that have shown that any levels less than 2 micrograms per DL is safe. So anything higher than that, you should start acting on it. Well, some people are using urine, and a few might have seen the provoked test, the DMSA challenge test for lead. Let me ask you, how many of you are using the provoked test, the challenge test? Have you used any? Oh, okay, great. Wonderful. Then I'm really glad that you're not using the challenge test, because challenge test, it's a great test if you have proper normal ranges to compare with. By challenging with DMSA or DMPS, you can dislodge all the metals, well, not all the metals, some of the metals, and excrete them in the urine. But since there are no normal ranges available at this time, the measurements that you get out of the challenge test, DMSA or DMPS, are not reliable. once again, are not reliable. Yes, it's a good way of taking the metals out of the body, but not to monitor how much you're taking out. So please do not rely upon the challenge test to decide your treatment plan or to monitor your treatment plan. Okay? Well, I need to hear a yes. Okay. Thank you. See, right now I am the teacher, so I'm in control. I know outside I will see somebody else and you'll say, okay, now I'm in control. So how do you protect yourself? Make sure good iron levels, good calcium, selenium, vitamin D, we talked about it. Make sure your thyroid is functioning well. And test water, toys, dishes, paint for lead. Anyways, toxicity associated with effects of these metals. I know you cannot read these slides. There's too much of material on this. But just briefly, these metals, toxic metals can cause all kinds of neurological issues, emotional problems. Like I was saying about the erectile dysfunction, for patients coming to you with neurological issues or emotional problems, your mind will go directly towards hormones, right? So make sure you keep in the back of your mind that if hormone panel or hormone tests are normal, then what to think, what to look for after that. Mental issues, GI problems, all kinds of issues related to bones and immune system, and so on and so forth. Cardiovascular disorders, cancer, eye problems, and many, many other things related to this. How do you diagnose? What is the way to diagnose any kind of conditions related to metal toxicity? Well, you have to make sure that you ask the right questions. Like, do you have any amalgam fillings? Then you know where the mercury is coming from. How much fish do you eat and what kind of fish do you eat? Has there been any exposure? Has there been any tick bite? So on and so forth. So these kinds of questions will give you some information from your patients. Look at the symptoms. How is your short-term memory, or do you have areas of numbness or strange sensations or any emotional issues or any psychological problems? Then you do lab tests, right? Regular lab testing using hair, stool. Well, stool is not my favorite, but I like urine better than stool for metals. I know you will argue with me on other tests, but for metals, I don't really like stool because you don't really get a good picture, and the concentration is very low. Whole blood, urine, and breath analysis is also being done by some labs. And then you try to find out whether there has been any exposure to any kind of xenobiotics. You can also run some indirect tests for proteins like ApoE, because ApoE is a wonderful protein that basically supports the detox of neurological, like the nervous system. That is a protein mainly involved in the detox mechanisms. So you can check for ApoE, you can check for cholesterol, increase insulin sensitivity, and so on and so forth. And then some challenge tests that I was talking to you about. Challenge tests are available using DMPS or DMSA. Anyways, just to look at, if you see something like this, then it's very, very obvious. Well, this is arsenic keratosis, skin keratosis that you see in case of there is recent exposure to arsenic. And this is something like that you see in a typical case of, this was an intentional ingestion of mercury. And so you see all this kind of mercury accumulation there. Lead exposure, this child was exposed to high lead content. And so this is something that you see, this kind of skin rash that you can see. This was in China, people living in a very cadmium contaminated area. They were being exposed to cadmium for a long, long time, and so that's how they saw in their hands and wrists. How do you treat these patients? Well, that's what you wanted to know, right? All this time. Well, you have to look at the genetics, mainly because several genes are involved in coding for production of all the proteins and all the enzymes involved in the detox mechanisms that we have in our bodies. And so you have to consider the genetic variability. And you have to do the genetic tests and look for genes, whether the individual has genes. Let's say we were talking about ApoE. So look for the genes that are there or not there in that particular individual who can produce these proteins like ApoE involved in detox mechanisms. So if they don't have the right genes or the genes are mutated, you know that, okay, now you have to think something out of the box. Whatever protocol was based on the use of ApoE or having ApoE involved in the detox mechanism, that's not going to work. Prior illnesses, so you have to consider if there were any kidney infections or tonsillitis or anything like that. Surgical operations, because surgical scars can basically inhibit the flow of proper flow of lymphatics, and that can affect the detox mechanisms that you're using. Any kind of medication or recreational drug use might overwhelm the detox mechanism. If there has been any emotional trauma, that can affect social status, high carb intake, so on and so forth. And if somebody has used homeopathic mercury dose, that can affect any kind of allergies, that can affect your detox plan. So before choosing your detox plan, go through all of these different points to kind of come up with choosing the right detox plan and the agent and how much of that agent you will be using in a particular patient. So there is not one dose, single dose that would work for everybody. So please keep that in mind. Take this pearl today that you cannot, well, you can't just tell me, Sanjay, can you just give me a dose? I mean, I could give you some idea on the dose, but that same dose might not work for all your patients because all your patients will be different in this aspect. So some of these pharmaceuticals are being used for the detox methods like DMSA, DMPS, Desferol, calcium EDTA, and IV vitamin C. I know Malaysia is sensitive to IV vitamin C. That's what I came to know. And I think you should fight for using IV vitamin C. Don't quote me when you're fighting. I will be one of you, but don't quote me. I might get in trouble and they might say, Sanjay, you're not allowed to come to Malaysia anymore. What's that? Go back. Yes. So anyways, say for example, DMSA can be used every 4 hours around the clock to prevent redistribution of mercury. See, whenever there is metal contamination, whenever you feel that there is a metal contamination here in this particular patient, always start with mercury. Always focus on mercury, because if you start focusing on anything else, let's say for example, if you start focusing on the symptoms, you might get confused. Say for example, manganese, the symptoms are violent behavior. And mercury's contamination symptoms are not that serious. Insomnia, right? So you might think, okay, let me fix the violent behavior first and take care of manganese. Whereas you should be focusing on mercury, because if you focused on mercury, manganese by itself will be detoxified along with mercury. So please start focusing on mercury first, and other metals can be detoxified along with the mercury. So that's something that you should always keep in mind. whenever you're choosing any of these detox agents. So these are some of the pharmaceutical agents. There are some natural oral agents which are getting more popular now in detox plans. Cilantro. I was talking about cilantro last night on the dinner table. And how do you choose or how much to use in terms of cilantro? Here I think you call it coriander. In some places in Asia, it's known as coriander. Fresh coriander, fresh cilantro is what you should be using. There is tincture available. If you can take tincture, great. There are some extracts available. If you can find extracts, that's wonderful. As long as you can take a good amount of cilantro, but again, you have to be careful that don't just take cilantro and think that the detox will work, because cilantro's job is mainly to dislodge these metals from deep connective tissues. Their job is not to excrete those metals out of the body. So if you think that just by using cilantro you can take care of the problem, then you're going in the wrong direction. You have to support cilantro along with either garlic or chlorella. And you should always take garlic or chlorella at least 30 minutes before you take a lot of cilantro or a dose of cilantro. Why? Because once the metals are dislodged from the connective tissue, once the metals are metabolized, or not really metabolized, or mobilized in the gut, into the gut, through the bile, as soon as the bile hits the small intestine, you should have chlorella or garlic sitting there to take care of or to pick up those metals and take it out of the digestive tract. That should be your plan, because you cannot leave the metal just floating around and thinking that it will go out by itself. Cilantro only takes it out of the tissue and moves it in the body. What takes it out of the body is chlorella and garlic. These are the main two agents, and fish oil as well. So, and how do you choose the right fish oil? It should taste little fishy, not too fishy, because when it tastes too fishy, that means it has been oxidized during processing of that fish oil. And if it doesn't taste any fishy, that means it's totally not good. So choose the fish oil which tastes little fishy. So that's the trick. And use balanced electrolyte solution. All kinds of electrolytes are very good, very helpful in supporting your detox plan. And make sure that you support your detox plan with, one thing I really forgot, which I should have mentioned, that whenever you're going through your detox plan, make sure to have your patients use a high-protein diet. High-protein, low-fat, and high-mineral. Because this is a perfect environment for your detox plan to work. Because you need good proteins to move or to mobilize and to excrete out the metals out of your body. So high protein, low fat, and high mineral. I know, lunch is ready. I'm done. I'm almost done. See, if you want, I can talk for the next 2 hours. There are all kinds of adjuvant therapies available, which I was planning to talk about, but she showed me zero. So I have to stop here. Lymphatic drainage, photomobilization. You might have heard about these. Sauna therapy, sweating is a good way to detox. Colon hydrotherapy, acupuncture, exercise, kidney protection, so on and so forth. So what can we do? because you want to ask me, okay, Sanjay, you told us all this fun stuff, but now what do we do? Reduce your exposures. Learn more about where and how you're being exposed. Eliminate them from your home, diet, garden. Filter your water, filter your air. Change your lifestyle. Focus on your lifestyles, because this is what we can do in our hands. Get as healthy as you can. Make sure you have good mineral status. We talked about it. Make sure you have good vegetable intake without the use of pesticides and fertilizers. Take clean supplements. Get tested for toxins. Identify exposures by testing, proper ways of testing. Figure out how much you have kept in your body and get it out, right? Understand your genetics, get tested. And finally, this is the slide that I borrowed from you, Dr. Narjit. Thank you so much for sharing this. You wouldn't do this to your car, right? You always keep your car filled up well, properly fueled up. So why keep doing this to yourself? Stop running on empty and educate yourself first. So enjoy your life, meditation, EFT, stress reduction, laughter, and love everybody. But before that, love yourself, love your body, and please love me too. Thank you.
Thank you, Dr. Sanjay. That was wonderful. We do love you. You know
Thank you.
that. Okay. So can we invite Dr. Homer Lim and Dr. Mazia for the token of appreciation and show Dr. Sanjay love? There you go.
Sign of love.
We've had him several times as a speaker, and he's such a wonderful speaker. We do love him. There you go.
Right. With that, before we go for lunch, please stay with me just for a few more minutes. We're having exhibitors appreciation sessions for now. Dr. Mazia and Dr. Homer, please remain on stage, since we'll be calling the each representative for all the exhibitors to achieve our token of appreciations. Right? So, Dr. Mazia, are you ready? All right. May I announce the most supportive sponsors for Longevity Conference Hope for Change. May I invite Aurelia Fama Sendirian Berhad.
Thank you so much, Aurelia. Without our sponsor, we wouldn't be here, so thank you very much for our sponsors.
That's correct. Thank you, thank you. May I invite platinum sponsors for the conference, Ecomo International, Sendirian Berhad. By the way, there are samples of hydrogen water still available outside, so they are welcome us to collect our samples, please. Those who haven't collected one.
That's me.
Yeah, and I understand it's worth more than 100 ringgit. Please collect your sponsors, delegates. Right, thank you. So our gold sponsors. May I invite representative from Well Lab and MPOB. Please welcome. Sorry. Cakaplah, mana satu? Ni IF. Pak ini sekejap je IF. IF siapa? Platinum. Okay. Don't worry. Alright. Another platinum sponsors, may I invite Representative FFIMT Sendirian Berhad. Thank you. Yes. MPOB, representative from MPOB, please welcome. Next, the list of silver sponsors. May I invite, we start with Surya Health. Surya Health is gold sponsor, correct. May I apologize, Carol. Surya Health is our gold sponsor again. Another one, Protarapic Sendirian Berhad. All silver. Ikut silver. Duty? Oh, okay, Euromobile. Representative from Euromobile. Then we do a quick one. Next will be Unique Remedy, Dr. DNA Diagnostics Sendirian Berhad, NutraWell Sendirian Berhad, Coral Life, Verita Pharma, Cypress Medic, Dr. Norman, BioGaya, Synergy, Berjaya Golf, Brigo Life, Zezen Health Solutions, MPCN, and Revon Media. To make it quicker, we have 23, all of them, all right? One by one aja. Yeah. Dr. DNA. Thank you. The jump. Yeah? Yeah. Yeah, please welcome. All are listed. Verita Pharma. Say something.
We are very, very happy and appreciative to all our sponsors. Dr. Norman had been very kind in accompanying us as well. Just a few more.
Yes, to go. Yes. Thank you, Senaji. Thank you. Thank you so much. Zazen Health Solution. From MPCN. Rayvon Media. Is that all? Thank you, Dr. Maza and Dr. Homer, and thank you again for all the exhibitors. All right. Before we go for lunch, video, the thumb drive in the form of thumb drive, consisting of the speakers' video presentations and the edited versions, and the slides also will be available at 150 ringgit. We can put an order at the registration counter. Participants who have not get their receipt of payment via email, please update your email. Please can do so at the registration counter as well. Well, now lunch is served. All right, the lunch we having lunch at Zest Restaurant.